workers. At that point, during the early 1970s, the Cuban Ministry of Public Health establishes a technical institute to start to prepare what they call social workers to go out into the community. Now again, this is not a university degree as we have in other countries. It's more of a technical degree. And the graduates work primarily as assistants to medical professionals in the community. So we start to see these technical, these social work technicians, as they call them, start working with the medical facilities, with the doctors and the nurses in the community. However, the students haven't received very much training in what we consider the community practice, which is something that we see now is really important and really big in Cuba, and we're going to move towards that. So as we move into the the 1990s and this special period in Cuba, following the end of the Soviet bloc and all of the assistance that Cuba was receiving, and we know that it was a really difficult time for their economy. And as Dr. Greer and Dr. Dwani have already mentioned, we see a significant increase in public health challenges during this time. Fewer medical interventions are being carried out. There's a huge scarcity of food, of medical resources, medicines. What equipment they have is in disrepair and in disarray. So they aren't able to keep up with the public health needs of the island. The housing, the infrastructures are falling apart. There's an increase in unsanitary conditions. So there's a really significant need that's happening at this point. And we're also seeing a lot of social challenges emerge as a result of the extreme financial situation that's happening. There's an increase in drug abuse and prostitution. There's a lot more street crime that we see, increased dropout rates, teenage pregnancies, single moms, all of these problems that they weren't used to because for some point there in their history, they had been able to ameliorate these things. The youth becomes a very particular segment of interest because of, again, they're turning to crime and the amount of people that were out of school and out of work during this time. So during this point, we move into what we call the neighborhood movement of social work in Cuba. The government decides to start prioritizing at-risk populations. Again, particularly from the most vulnerable neighborhoods, in the areas that are really affected most by the special period. The Constitution creates what they call the People's Councils, or Consejos Populares. And these councils are functioning at a level between the municipalities and the neighborhoods. And basically it's comprised of different delegates in the community, administrative entities, and social work has a very significant role during this time. They're charged with addressing the economic, the medical, and the social needs of the community. And again, the focus is on the at-risk individuals in the poorer neighborhoods. So as a result of this, Cuba has a really interesting approach to social work education, which really, again, has a significant correlation to the public health. They develop a two-pronged approach to social work education on the island. One of them is a university program established by the Ministry of Education. This is their first actual degree program in social work through the University of Havana. And basically, it's not really a social work degree because they didn't really have that. It's a major in sociology with a concentration in social work, with a really, their curriculum is very heavily influenced by health. So they call these the public health social workers. When I went to Cuba, most of the social workers that you talk to identify themselves as public health social workers. So they really see themselves as a part of the public health system. And they do work very collaboratively with the other professions that are concerned with the public health. So this was a 3-year program, and it resulted in what they call the licenciatura, which is the equivalent of what we would consider like a master's degree in social work. And it was attended by students that were currently already working as social work technicians out in the communities. But this allowed them to go back to school, and they were given time to go back to school and to complete this degree program, you know, while working part-time and going to school at the same time. One of the first things that this did was to provide a theoretical framework for what social work is. We started to teach people the theory behind some of these social problems. It was no longer just about going out and being philanthropic. There was actually, you know, a theory that students were being taught, especially around the sociological factors that were impacting the health and well-being of the community. Now, another really interesting event in the social work history in Cuba was this idea of the Imminent Days. So this was kind of a very novel and unique idea that they had in the late 1990s. Again, coming out of that special period, or they were still really affected. A lot of youth that were unemployed, that were not going to school, and again, a lot of crime that was happening during that time. So one of the things that happened was that the University of Havana was charged with coming up with this paraprofessional program in social work. And basically what that did was that they started to approach students, or actually young people, who were out of school and who might otherwise not have opportunities because they were from really at-risk populations and neighborhoods. And they told them that if they went into this program, what they could do for them was that they would guarantee that they would have a good paying job as a social worker after this 1 year sort of rapid immersion social work program. So they took these youth, mostly between the ages of 16 and 22, did this full immersion program for a year, and in the span of about 10 years, they trained 40,000 social workers. Now, very vastly different training, obviously, than the 3-year program that other social workers were going to. This did not have a public health component necessarily. It wasn't, the curriculum was not heavily influenced by public health, but basically what they were doing was that they were encouraging these students, who were teaching them how to engage into the community. And the idea was that they would go back into the communities that they were from. And because they understood the community and they knew the community, they would then partner and really try to affect change within that community. They were known as emergentes because they addressed the emergent social problems of the time, so that's emergente in Spanish. Now this was actually, when you talk to social workers in Cuba, there was a huge controversy that emerged from this. The social workers that had the longer training sort of felt that these other social work technicians, so to speak, or paraprofessionals that had less training should not be calling themselves social workers. And there's actually a lot of confusion on the island as a result of this, because it's a tiered level of social work, and nobody really knows. You even talk to, even in some of the healthcare settings that we went to, people had a really hard time sort of differentiating between the two levels of social work. Unfortunately, all of this ceased in 2010. At the moment, all of the social work schools in Cuba have closed down, and there is no training for any social worker on the island at the moment. So they're basically carrying out all of the social work services, the provision of social work services, with the people that had been trained prior to 2010. So that's a little bit of a history in the context of how social work emerged in Cuba. So in terms of their role in public health, social workers on the island are an integral part of the interprofessional healthcare team, and they do work at all levels of the country. They work at a community level. They work with the nurse-doctor teams. Now in Cuba, every neighborhood has, or mostly every neighborhood now, has what they call a nurse-doctor team, and basically it's a house. It's like a 2-story house for the most part, and the doctor actually lives upstairs, and the first floor is like a doctor's office. And the idea here is that these doctors will see patients from their community during the day, and then in the afternoon will actually go out and do home visits and visit the homes of the patients to sort of establish better relationships with the community. And social workers are part of this team too. So it gives the healthcare team an inside view, a more systematic view, not only of their individual client, but also of the family structure, which in Cuba is very important, because we know that in Cuba we have families, a lot of households are 3-generational families. We have grandma living with a daughter who's living, and living with the grandchildren. And mostly because of the housing situation. There's just not enough housing for everyone, especially now as the infrastructures have been affected, people are sort of being forced to live together, which poses some interesting